again, but I will. So today I thought we might just want to check in with one another, report on how things are going, see if Arch can help in any way, if your colleagues can help in any way. Next month, I'd like to have a discussion about sharing the wealth, about how we can maybe do webinars to help the whole network move them up in terms of sustainability, support the sustainability efforts. But Nadine couldn't be with us today, and she for sure should be on the phone call. And in particular, New York's really advanced. Massachusetts is doing some good data planning, and in terms of collaboration and grassroots, Nadine's really strong. So I wanted those states on the call. So I thought I'd postpone that and just jump to report ends. But first I want to talk for about 5 minutes about the list. This is the list. And the list is what people need to know if I die. And I got my first COVID vaccine last night. This seems less urgent, but I've had leukemia for 11 years. So like, it's interesting. Gradually, I've like the first year I did all the photos and I put them in according to kids or relatives in the acid-free envelopes. And so I've done little things, but I've postponed really doing like, okay, if you die. And so COVID came on and I, figured out the will and trust and stuff. But this is the list. This is the list. If I'm gone tomorrow, somebody can pick this up and know every major thing that needs to happen to protect all those I protect. I have a brother with a lifetime severe disability that I help. And if those of you who have family members, it's complicated and there are things you do and there are people you call and there are organizations you deal with and money organizations. And so and I'm the one that does that stuff. So with you in leadership roles in your states, you may not have this list written down, but I think all the people on the call are the ones that take care of all this stuff, and you know who to call, and you know what's due when. And so I'm suggesting that everyone make a list. Jill and I have both seen states that have been really, really strong. And the person that is like you, all you have strong leadership positions. If for some reason they left, we've seen states really struggle because, everything was on one person's computer. We've had states that couldn't find even their annual reports. And we all know annual reports, they just give you a glimpse of what you're really doing. So think about how you can share the wealth, how you can pass on what you know that's absolutely necessary, but also your wisdom. When I write states that that brag about all your activities, I go to your reports, but where the wealth is really in your webinars. New York, you're a great example. You've done some like wonderful webinars on the sustainability planning you've done and other things. And that's where I really kind of get a feel for what you're doing. So in terms of succession planning, make your list and think about where you want to send people. Like you could put links to your presentations on that list. But yeah, the list. Okay, that's my 5-minute mini lecture. By the way, this is really painful to do because it's you have to think about like, oh, it feels so good when it's done. I mean, every time I like hold it now, I'm like, I have to think about that. Okay, enough of that. Let's hear what everybody's up to. Who wants to jump in? What's going on in this time of COVID?
Well, I'm going to start with your list because you brought it up. So back in 2002, I started a program at Lifespan called Future Care Planning Services. And it was a program to assist caregivers of adults with disabilities to do legal and financial planning. And it included a letter of intent and all the likes and the dislikes and the quirky things about these people, that if the caregiver were gone tomorrow, what would they do to be able to? So it was that really personal information about a person with a disability.
Yeah.
It was the legal stuff, the wills, the trusts, the healthcare proxies,
Right.
the guardianship in some cases, and all that stuff. So we're looking really hard right now in New York at expanding that concept into virtual planning. But what we've learned over the years in future care planning, which is still a very
things I've got to do, so that's good.
live and well, is that caregivers need handholding. There's tons of platforms out there online that caregivers can go through, but we've looked at a couple of them and they're very surface. They don't go
Mhm.
deep, and they
Mhm.
don't allow the caregivers to have anyone to support them through that. It's just like, you go through this process and then it'll all be done. But that's not how it works. You know, you just did the list.
Yeah.
So we're looking really hard at developing that as a statewide model. We've gone to a couple of foundations who, what shall I say, they're a little reticent to fund us because all that other stuff is still out there. So we're really trying to help them understand that what we've learned in the virtual environment is that we can hold their hands and not be in person, which gives us the whole state, right? It's not just here in Rochester where we've been doing it, but it gives us the opportunity to expand to the whole state. So
Wow.
I just thought I'd share that because your list.
I know
wasn't-
that's so great. Jill, I'm not sure you're recording, so I'm just taking.
It says recording.
Oh, do you do? It's
Yeah.
not saying that on my screen, but maybe that's just me. Okay, good. Yeah, I want that. I want a record of that. That's fantastic. And there's a parallel with sustainability planning. So what you just said was that, yeah, there's this list of things that you need to do, but there's a relationship, and to make it person-centered. So if you just make the list and you don't have those connections, there are people connections that are not represented just on the list. So
Sure, there's attorneys, there's financial consultants, there's Social Security, there's Medicaid, there's all those things that are bureaucracies in many cases that are hard to manage. So,
Yeah.
you know, and in terms of sustainability, in my mind, this is a fee-based service. So we're not there yet, but we're looking to get there.
right. And so in the wisdom among leaders is you all have relationships with one another. You know who to call. But if somebody walks into a job, and we've seen this over and over again, who do they call that knows everything? Who are the connectors? Hi, Leanne. Leanne just joined us. Who are the 6 degrees of separation people that you know that can connect you with other people? That should be on the list for somebody that's new. And the connectors need to be kind of warm supporters too. You know, if you're new on a job, you need somebody who can give you guidance, but also support you and kind of buoy you when you're trying to figure everything out. But
Well, and I will tell you that when I walked into this job, they handed me the guy's computer and said, "Here you go. You got to do a newsletter every month and figure it out." That's what I started with. And Dina wasn't with us, and Abby wasn't with us, and that was, you know, those were the days where I was just going, well, I'm just not sure what to do with this. But
yeah.
Once Dina came on, it kind of all started to gel a little bit more. So
Yeah.
um,
So Dina, that means you need the list.
you need to make the list, Dina.
Need to make the list.
Because you have nothing else to do right now, right?
I know.
Well, yeah, in fact, it's those people like Dina, and then we can name a number of them that come into jobs. And it's often those states that are really strong, like New York, when it wouldn't happen in New York because I already see these strong partnerships across agencies. But when it's really centralized and there's someone really strong and they leave, the state can seem strong, but if a pivotal person leaves and hasn't mentored other people, doesn't have the succession in place, it's not going to stay strong. So anyway.
Especially if there's a vacancy I think the person I replaced, it was vacant for a year. And
Yeah,
then, so the first year I would say, when I came in, a lot of it was cleanup and trying to catch up. And, so you couldn't even really get into any sort of strategic planning or, trying to think forward. It was like trying to just catch up on everything that had been missed for that whole year of no one being in the position. So
right.
I have a cool document that I'd be happy to share. And it was funny because when I was asked to complete it, so I've been in 2 positions since this position at the state office, but when I was in my role in the SHIP program, which in New York is called HICAP, they, of course, were very concerned when I was moving on and the new person was coming in. She had a lot of experience, but the manager at that time was very worried about just her not having, like you're saying, all of those, pieces of coordination, knowing who to call if she needed help. So they actually gave me this, I don't remember, there was a name for it. It's an Excel file, but there is an actual name for it where you're able to kind of complete it, and it helps guide you in making sure that you're documenting everything so that if you're, moving and giving all these responsibilities to someone else, it's like very clear and laid out for knowing that person knowing what to do or who to turn to if they need help. So I was joking because when they asked me to do that for the replacement, I was like, wait a minute, nobody did this for me. So to my knowledge, I am the only one who ever filled that out. It was only this one person who utilized this tool. And it was very interesting. She kind of shared the story that unfortunately in her previous job, they had one of their staff walk to Dunkin' Donuts on a break and was hit and killed by a car. Very tragic, sad story. But what she had shared was what they learned out of that was nobody knew what she did. So after that, they had to kind of do all of this to try to make sure that never happened again. So I'm happy to share that in case it could be useful for anybody.
Yeah,
Okay.
we would love that.
I'll dig it up in my files. It was a good 4 or 5 years ago, but I know I have it.
Okay, super.
And as for all our videos, we started a YouTube channel, and everything we've ever done is up on our YouTube channel.
Yeah, that's great.
I was going to say for Deanna, maybe we can preface that story with if someone in your staff wins the lottery.
Yeah, instead of
Wow.
getting
Yes,
hit by a
that would be
bus.
much better, right?
Yeah.
Much better.
Yeah.
I don't know. My old executive director always said the same thing. What if you get hit by a bus? Nobody's going to know what you do. So
I know and you always, people do reference it that way, but to actually have a true story like that, it was just heart wrenching. I was like, when she shared it, I was like, I thought at first she was, especially the way she said it, I was like, is she just saying this theoretically? I was like, really, that happened?
Yeah, it happens. So, the video idea is really interesting because I mentioned that when I'm writing things up for Arch. I just love to go to videos. The grantee meeting, actually, when we're brag and borrowing, and people report. So yeah, think about that kind of documentation, because the list passes along one kind of information, and then the webinars and videos pass along the kind of information with heart and with substance, because you want people to be able to know the mechanics of carrying on your program. You also want them to get the feel of what you're doing, the kind of nature of the programs that you have. So good for New York for videos. I think Nevada's got a lot of stuff too, that tangible stuff that you can reach. Now, Leanne, you're doing more esoteric stuff that's really important in terms of the data coordination with what's going on in Massachusetts that's new. How's that going?
Good. It's going well. So what's going on that's new, I guess? Well, I submitted the report. You got that last night, right? Yeah, so good. Hope you had a chance.
I'm doing that. Yeah, I'm doing all that this weekend. So I've got my little list and so thank you so much for that.
Yeah, so Massachusetts, we're big with the data, I'm a I love data, so that's a big thing for me, but, so what we've been doing is, we'd conducted a SWOT analysis about a year ago, and so really taking that seriously, what the coalition was looking to do as far as where we saw our strengths and opportunities, and keeping in mind sort of what the weaknesses and challenges were. But we are taking the information that we've gotten. We are partnering with the state on the ADRC call center, the Mass Options. Initially, it was going to be a separate call line, but then when the state got sort of wind, when the higher ups got wind of what we were doing, we've had a series of meetings. And so we are actually tacking on to the existing system within the state, which offers us a tremendous amount of sustainability because it's legislatively funded. And
Right.
so, yeah, so we're real excited about that. And, because we are up for the next grant. It's sort of, I'm the one people are saying, well, how are we going to sustain this? And I said, well, we're just going to build it and hope that the money comes. And so it's kind of, I felt like someone handed me a silver platter. So I was so excited. So we are now doing that. The other thing that we had developed core competencies, which I've recently shared with Jill.
Mhm.
Core competencies are a recommendation for training, but we do have a training, the Massachusetts Care Curriculum, and we are partnering with one of our state universities who actually has a course for their health professions. It's an elective course, and its focuses on respite, and it trains the healthcare providers 1 hour a week. They have a respite curricula that they use, but when we've partnered with them, they're going to actually use our curriculum, and they have, so they offer the training, and then they have a practicum for the students where they're paired with families in the community, and then the students provide respite for 2 hours a week. They go in and during the semester, and there are some challenges because once a semester is over, the students aren't obligated to remain, but some do. And so
Mhm.
we're going to be expanding on this, and hopefully the goal is to develop a toolkit for other colleges, community colleges and universities to be able to follow along with this model. We are learning just from doing our research, which is one of the subcommittees that we formed, about other programs in the state that are sort of happening in like a silo and doing something like this. So we're just really trying to pull it all together. That was one thing that came out of the SWOT analysis, is that as much as we can find existing systems and build on them rather than trying to duplicate it or replicate it, it's just, that would be the ideal. So that's what we're doing there. So, we've updated our respite directory, and we've enhanced how we collect data on the directory. So now we can see where the respite providers are and where the requests are coming from. So we get a better view of supply and demand within the state. We definitely
Mhm.
see that there are areas within the state for recruitment. So we'll look towards like the Mass Options call center and the college systems and things, and see how we might be able to get out into the community and to expand on that. So this, we're in our last year of the grant, so we're trying to, and hopefully with the next round of funding, we'll get funded. But so we're trying to be mindful as far as what we can take on, and try to build systems. If we don't get funded, that it can continue on without us. But
Yeah.
fingers crossed we will. Yeah.
There's some really nice kind of trends in this group that when you were talking about your partners and the tacking onto the existing system, it reminded me of New York, and New York connects in your data collection, same also New York and Nevada, the ability to know what's going on as you go. And then when I heard you talking about the core companies, I'm assuming you're already talking to Wisconsin and you know about their.
Mhm.
I was just thinking, Jill may kill me here, but I would love to see a panel webinar with all of you who are working on competencies in New York. So that we've got Rhode Island, because it seems to me a good way to sustain is start to embed in those university and college systems.
Right.
Coming back from that background, I'm always excited when you partner with a university and get
Yeah.
that going. I'm doing a training. My background's in early childhood, high-risk families. So I'm doing a training with the school district in March on mental health. And one of the things I've talked to them about is respite. None of them, didn't know what respite was. And this is their whole school district. So I'm trying to get them, you know, put respite in their mind. So there's kind of partnerships where we would cross fertilize. I think
Yeah.
that may help with our sustainability too. So
Yeah, the only other thing that we're doing, so our focus for this year is the training, the referral line through the Mass Options, the ADRC Mass Options, and trying to, the training both with the core competencies, getting it out into the college system. We're working with this one college right now. And then the only other piece on that is that we are developing an online training because we have 7 state agencies that provide respite. They do tend to operate in isolation, but we have convened the state action group. And so we are creating this training to inform all of the caseworkers and family advocates within each of the state system what their sister program does. And so it will be sort of a, you know, trying to inform across the table. If you have a child with a disability and a parent who is caring for that child, and that parent needs respite, that there are other programs within the state where the parent may go. So for example, if there's a veteran in the home, you might want to look at Veterans Affairs.
oh yeah.
You know, if you have other children that maybe have an IEP or something like that, and really trying to educate the caseworkers and family advocates that as you're working with the family, looking at the whole family unit as far as what additional services may be available, and then trying to funnel everybody into the Mass Options. And so because we had done a series of focus groups with these caseworkers and just telling us, you know, tell us what you experience when a family calls you or a parent calls you, and that this is what we heard. So we brought this back and we had a great meeting on it. So the result is we're developing this sort of onboarding online training on, this is Massachusetts, this is our respite system that's state funded, and this is how it works. The eligibility is here, the access is here, and so, and these are the limitations to access. So,
Yeah.
you know, yeah.
Yeah, I remember you talking about this at the research summit. This is really important to
It's-
also for
yeah.
sustainability, to think outside the box, think
Yeah.
less categorically, think more
Yeah.
pragmatically. Great.
This is a big thing. This is a big thing that we're doing. I'm really excited about it. Yeah.
And hey, Jill, did you want to jump in about the competencies? Are you there?
I'm not sure. Can you hear me?
Yeah.
Oh, good. It's working now. I don't know what that was. No, I just wanted to remind everyone that Arch is partnering with the National Academy for State Health Policy, the Respite Care Association of Wisconsin, and Kim Whitmore at the University of Wisconsin to develop a set of core competencies for respite care training. And we have an expert work group of mostly national organizations that have experience in direct service worker competencies, including folks from Anchor and PHI. So we're really excited about that. And state experts like Leanne have done so much on workforce training. But this is going to be a 3-year project where we select core competencies for respite. We crosswalk them to the already existing online training that Wisconsin has and make sure their training meets all of those core competencies. And then we're going to field test it in several states. And so those of you that are interested may have an opportunity to help field test the new revised training that meets core competencies. We'll then evaluate it so it can become an evidence, truly evidence-informed training curriculum. That's a few years down the road, but we are working on that. I just wanted you all to know that as you're talking about core competencies.
Thank you. It's exciting.
It's a big project.
Yeah.
And I know Doris is already very interested in that, and states can already work with the Respite Care Association of Wisconsin. They're making that online training available to all of you out there. I think South Carolina is already working with them. I think South Dakota is already working with them. And they're providing it for free. I mean, there is to use their platform, there is a monthly charge per person who uses the training, but it's really minimal. So it's worth already exploring with Wisconsin if you're thinking about developing online training.
Yeah, and what's cool about the Wisconsin training is that if you, they have to go through and it looks like there's pre-posts in each of the different units, and whoever takes it has to pass with 75%, and then they are put into the respite database in Wisconsin, which is something we're really excited about, kind of trying to model here.
That's fantastic.
And again, in 2 or 3 years, the training will be even stronger than it is now, based on the work that we hope to do.
So, this is interesting, Jill, because, REST initially adopted the core competencies that came out of Arch. So I'm interested to see if that changes, because we are still offering Train the Trainer REST in New York in our own modified version.
Yeah, those national respite guidelines were really never tested as core competencies.
Okay.
But they certainly they will provide some guidance as we develop core competencies. But they were never tested, as far as we know, in training curriculum. They were just guidelines that we put out there to help all of you who are starting new respite programs think about categories that you should talk about when you're developing quality respite services.
Well, I don't know if you want to think about it, Jill, but REST did a whole lot of data and testing on the training, which included all the core competencies. So there is that data out there.
On the literature about what a quality respite program is, but it wasn't really meant to be core competencies for training, but it's certainly a great start.
Yeah.
We just want to formalize it a little bit more as core competencies specifically for training. And field test it.
Right.
Good. Do we want to hear from Cheryl or Corey? Are you there? What's going on in your parts of the world? Or do we lose? Let me see.
There's Corey.
Cheryl had to leave, but Tracy is on the call.
Yeah, Tracy, I missed you on my screen. Sorry.
Go
Hop
ahead,
in and
Tracy.
let us know what's going on.
We did release our white paper recently for the state
Right.
for our legislators. And I know we've talked a lot, about data, but so our Alabama Lifespan Respite Coalition, in conjunction with Alabama Department of Senior Services, wrote the white paper. And we helped them collect data for that through caregiver surveys. So we were not the only ones. The ADRCs distributed those as well. And then all of our coalition partners, including, Medicaid, public health, rehab services, all of those organizations helped to distribute those surveys as well and collect a lot of that data. But one of the recommendations that was made in the white paper for the legislators to consider is having a standard caregiver survey that distributed on a state level going forward. And so that's something we do think would be very beneficial. Our legislature is in session right now, and they have the white paper in hand. And so that's something we're really hoping that will, come to fruition. That's one of the big things from the white paper that we're really hoping will happen, so we can effectively all catch some really good data and know how to better support our caregivers across the state. So
And
that's one thing.
Historically, have they been responsive to the white papers? Because you've done other white papers. I mean, this is something I really admire about your state, that you
Yeah, this-
advocate based on data.
Yes, we have. And like I said, we have really good partners, especially AARP and, Medicaid, public health, all of those. We have a really great group of partners to help us in those efforts to get our message out to the legislators. And yes, they have been responsive, and we're very grateful for that. They understand the importance of respite. I was sitting in on a call maybe a month ago with the Speaker of the House, and he brought up respite on his own without even knowing I was on the call. And I mean, that was such a big moment. It's like,
Yeah.
that was one of the things he said, we're really putting great importance on in light of the pandemic, especially. He said, we understand how hard the pandemic has been, especially on our caregivers. And so we're going to do what we can to get more support for them while we're in session this time. So, that was a really great aha moment, for them. So, yes, they are responsive. And I'd like to think the white paper helps with that.
Yeah, I think your timing's so good, because it seems to me that COVID really creates a big teaching moment. I read the paper every morning, and I don't think there's a morning that the Washington Post or New York Times does not have a story about how difficult it is COVID has been on caregivers, and how children are suffering and how families are suffering. So it's really on the mind. So it's so great that you could take this time, particularly when people are open to hearing that message, because they're at home with their kids, or they haven't seen their, aging grandparent, or whatever it is that I think opens people to the message. So good work, good timing. Yeah. So fantastic. Tracy and Corey, what's going on there? Can you hear me?
A lot going on. Well, actually, that's not true. We are actually having, the state will be sort of transitioning NLRCC to be an advisory board for the state. So we're working with them for that. They got a grant and they want to transition us to that. And so we're eventually we'll be doing more of the white papers and just more, strictly the advocating. And so that's exciting and scary all at one time, because we're sort of going away from what we have been doing and completely going into a different direction. So we've been meeting with Cheyenne Pasquale, which, Doris, do you know Cheyenne? No. So we've been meeting with her like every week, going over different things and looking at some of the other advisory boards, like the Alzheimer's Advisory Board and AARP and things like that, to see how we want to roll this out.
So you mean you're looking at like the advisory boards as models for what you want to do? Okay.
Yes. Yeah. So eventually we would be a revised statute type of thing, what we call NRSs, Nevada Revised Statutes and stuff. So we would be automatically, where we would have to be funded and things like that. And we will have an executive director now. It will not be a whole volunteer board. Cheryl Donnell is going to be our executive director. So some exciting and scary stuff going on right now.
It's a really exciting, there's a lot for us to learn from you as you go. Like
But there's
what's
a lot
working.
for us to learn as we go.
Yeah. Yeah. So when you're looking at boards, like different models,
hmm
what have you learned, or what do you, what do you know, like, how do you know even what to ask at the beginning?
Well, that's where having people like Cheyenne and Jeff Duncan and things like that, they've been with the state for so long, and they've been so big in some of these commissions and things like that. So that's where we're working with them on that. In fact, our entire membership doesn't really know what's going on. I get to be part of the group that tells them in about 20 minutes what's going on.
Uh-huh.
So since I'm one of the board members, but yeah, so that's what we've been doing, and we're trying to figure out the best way for us to go in the future and keep our coalition expanding and doing, you know, the work that we want it to do. But you guys did make a point of, you know, sort of drove home the list thing for me. Because I've been secretary for so many years. It's all backed up on our Z drive for my normal company, but I don't know if anybody, I mean, my executive director would be able to get to it, but that's about it. So it made me
At
think
least
about
there's
that. I'm
one.
like, yeah, it made me think about that. I mean, I have a lot of information in here for the Nevada Lifespan Respite Care Coalition, and I don't have it all where it needs to be or what needs to be done. So, I know I have to update my standard operating procedure manual for my normal job, and made me think about that. And I was like, crap, when is that due? It's due Monday. So I'll be working on that this weekend. So, and then I think I want to create something like that, or the list, you know, for the NLRCC too, because you know, as you get new presidents and new other people, you don't have, everybody does things different, but they don't know where everything is.
Yeah.
So you made a really valid and home hitting point on that.
Yeah. Yeah. It's, yeah.
And I'm not walking to Duncan in New York because I'll get hit by a bus.
Yeah.
So, okay.
Yeah. Thank you.
No, thank you guys for all the wonderful ideas. I love this, the collaboration we have here.
I know it's a pretty amazing group, isn't it?
Mhm.
So this, I'm so intrigued by the board idea, and because of interviewing the program, innovative and exemplary practice programs, what I've noticed about the ones that are really strong and long lasting, when I know it's different because you're at a systems level, that's different than a program level, but there's some parallels between coalitions, I think, in those programs. And the ones that like, they make this transition to the board, to having a board. And so I'm really interested in like how it's constructed, what makes it functional, what makes it lasting, because I think this is key for some respite programs and systems. So as you go along, I think we're going to learn a lot from you. So what precipitated this decision? Was it like a long time coming, or?
I think the state, they got this grant hoping to have us become more self-sufficient, but as we were talking, we realized that as the coalition is made up of so many different organizations, because you know it's lifespan, we didn't have somebody that was working for the coalition, so we needed an executive director. We needed a Doris that would lead us and get us where we need to go. And as the board president, you're volunteer and you have normally another job. Well, I put in, you know, 50, 60 hours a week on my normal job, and then I have to put in more work on this job, and it just makes it hard. So they wanted to do it this way. So we had more of a direction to go. And we thought about, man, there's just a lot. It was sort of a really emotional change for a lot of us because we've been doing it one way so long, and now we're gonna try and figure out a new direction. It's exciting, but it's still emotional to let go of the past per se. So having an executive director was something we wanted to do anyway. The problem with getting grants is there was a lot of competition from within the organization because we all work for respite in different varying degrees. So there's some competition in that. And with our fiscal agent, we have to ask permission to apply for grants because if they're going for the same grant, they can't back it for us.
Right.
So we still have a fiscal agent, but we're not a 501c3. We're a 501, but not a C3. So we're trying to, we're trying to figure out the best way to do all of this. And we're hoping this is it. So that way the state can continue to ask for grants through the respite, like Arch and things like that, and continue with that kind of program and continue the word and advocacy. We just decided that's what we're good at is the advocacy and education. So that's what we want to continue on.
So you're playing on your strength.
Yeah, we're playing on our strength.
And when I'm hearing you talk, I heard a couple things. One, that this is really strategic. All these decisions are strategic. And when you said they're emotional, it just sort of reminded me of my past when we've gone from small to big. When you're small, there's an intimacy and there's grassroots, long relationships, and it is changing that structure. You worry about losing that because it's so precious. That experience of building something together. So this is, it takes some bravery too. It's I'm excited and I'm really excited to learn, as you go.
We are excited. It's just like I said, like our past president, this was not the direction she wanted to go, but I think it is the best direction for the coalition and the state for us. And I think it will be a really good thing. It's just, it's new.
Yeah. I think you're going to, just from watching you, been hearing you over time, I think you're going to be successful. So I'm excited for you. Yeah.
Your lips to God's ears. Thank you.
Yeah. Yeah. So
no, we know we have a good leader choice for us. Cheryl Donnell is very strong, so we're very excited about that. So.
Good. So Abby, we haven't heard from you. What's on your mind?
Sorry, I had to unmute on my phone. I'm kind of just taking it all in. I mean, I think Doris and Dina, shared what's going on in New York. I thought it was funny when you said about making the list, because a lot of times Dina and I work on a lot of projects together, and she always says to me, well, in case I'm not here tomorrow, like this is what's going on. So I think that's really important, to get all of that stuff in place. So
yeah, that's called mentoring. Yay, Dina. That's one of the big things on for sustainability, that you have somebody that you respect and that you share information with. So that's fantastic.
I know something that might be helpful that Abby and I are working on that I think is tied to sustainability that we had written for our new grant. One of the things we struggle with, we have a very robust, as you know, the New York Connects Resource Directory, but, Doris has kind of been keeping kind of her own directory just for purposes of people that, she ends up learning about or talking to. And the way that we've structured our resource directory is the state office does not control the, maintaining of the resource directory. So that's done at the local level. So each county is responsible for their resources. So it makes it a little tricky when Doris identifies, a respite provider or another resource that maybe is not in the New York Connects Resource Directory, in helping to make the connection.
Mhm.
So we did just, we met with a couple interns in our office, and they took a good first stab, but we just learned that due to the pandemic, their time with us is going to be cut short. So this will probably fall back to Abby and I. But we're thinking we can develop some sort of form, like a PDF fillable form,
Mhm.
that the organization can be presented with, and will just help us, I think, in connecting them with their local New York Connects program, so that that information can be considered. The tricky part is there is inclusion exclusion criteria. So I think we have to make sure that they understand by completing this form, it doesn't necessarily mean it's a guarantee that, you know, their information will be in there. Can't
Right.
imagine it wouldn't be, you know, considering what it's for. But so now it's going to come down to us having to work together to kind of, you know, draft the purpose, the directions, and then really think through an effective process. I'm hopeful that our agency may consider us kind of being involved, so that we can do the follow-up and making sure that it doesn't get lost, you know. So maybe, you know, if Doris is handing out a blank form, if the direction is that they're sending that to us at the state office, maybe we can then make sure it gets into the proper hands of getting to the local program, and we can get a confirmation that it was received, you know, and we could follow up to ensure that there was a connection made at the local level. So we're in the midst of that right now, but I think that that'll just help us make sure there's quality resources in that directory, and you know, that we maintain it.
Yeah, that's fantastic. And you're doing the work so that individual families don't have to do it themselves over and over and over and over. Yeah, that's great. Wow. I feel
And Jill, yes, we are going to have the form online too, but I think the thinking was that we're not sure if it would be better to have Doris point them to have to go somewhere, or to have the form and give them the option of either. You know, just thinking about not being sure if, you know, what I know these are all kind of details we need to work out, but we did actually talk about, because we don't know where we would house it. It would probably have to be at the coalition, but then that gets tricky because, you know, of all the players that's involved with New York Connects, and technically the AAA is the owner of the data. So it's a little complicated, but we're, you know, we're starting the process, and would love to hear any ideas people have. And I think, Doris, this will probably be an agenda item for us with our next sustainability meeting coming up in April that was just scheduled.
Yeah,
So we could probably talk.
I was just going to say, we've reconvened our sustainability planning group. So the core team is, you know, Dina, the New York State Office for Aging staff, the Monroe County staff who work closely with us, Lifespan and the Coalition. We're going to meet virtually with our facilitator April 1st and 2nd. And really, you know, we have to look at that. You know, I had sent you can't remember the name of it. Oh my God. I'm getting old, people, and I'm scared. Okay. Anyway, just to relook at all the work that we had done, especially in the light of COVID, because somebody mentioned a SWOT analysis. It's really time to take a look at that again, because the landscape is so different than when we did it. So then we decided to have the work that we do there really inform our next sustainability conference, which we've decided to go totally virtual, much to my chagrin, but we're going to do it that way.
Yeah, it can work out. It can work well, Doris, the virtual. And Jill has the name of, if you don't have somebody to help you with the technology, the person that helped us with the research summit,
Yeah,
got her name. I mean, she's like,
I think Jill sent that to me already. Did you,
yeah,
Jill? Yeah.
yeah, she makes a big difference. I just have to say thank you to New York. You know, when we started this group some years ago, it was based on that original grant project where a number of different states used the toolkit with varying success and varying frustrations. And originally we were hoping that everybody would do real-time planning and that we would be able to post plans. And New York, you are walking us through this process and sharing your documents and making it really visible to people. And I think that's a huge contribution to the larger network. Now, whether or not they'll look at it, I don't think, but you know, when Arch does those surveys of what people need, sustainability is like way up there every time from all the different grantees. But it's just, it seems so overwhelming to people to do this planning. And, you know, I think it's like look, the list is even hard to do, right? And the list is only part of it. There's like succession planning and mentoring and the SWOT analysis, and then like the SMART analysis that Nevada used. There are all these different components to it, but to see the sequence of those and just to see the value of it in your work. And, you know, we have some really strong states here. So that kind of brings me to what I'd like to do, like our next meeting, is to really have you all kind of think aloud about how we can share the wealth and support other grantees that aren't as far along as you in terms of planning, data collection. I mean, there's just such advocacy that Alabama does. There's such a wealth of knowledge here. I'm trying to think of how we can be supporters of the whole network. So just kind of mull that over in your not spare time and think about, you know, whether or not we'd like to maybe organize a webinar or two for the larger group. And, you know, I can think of some really great ideas about planning and data collection and advocacy from this group. So it needn't be so onerous a task on, you know, one person to do a whole hour-long webinar. I think we could kind of pair people and do 10-15-minute just shares with the larger group. That would be a real gift, I think, to them. So any parting thoughts from the group? I feel smarter at the end of these calls, I have to say. I mean, you're all really impressive.
Well,
This is Sharon Grow.
I enjoy these calls, so thank you. And we're happy to help share with the larger group in any way we can. I'm sure Dina and Abby would agree with me.
Thank you.
Yeah, I enjoy these calls too. I think I don't know if I'm one of the newer ones that came to this project, but I also know that Jill's asked me for a few things over the last year or so, and I know that they're sort of hanging like the one thing that Massachusetts is we created that definition. And so we had a whole process that we used. And so I'm happy to share how we did that. We're starting to roll out that definition. It's really driving a lot of the work that we do. So,
Yeah.
you know, if you could send me a little reminder, Jill, of the different things you have been wanting, that would be appreciated so I can respond and give that to you.
Yeah, that's fantastic. So maybe we can figure out a framework of like sort of the basics of what grantees need to know for sustainability and do, you know, these kind of shorter mini presentations, like here's an example of this part of it. Here's an example. You need to do all of them, but here's how you do this part and how they're connected. You know, like this is Alabama always impresses me in this way. They seem so kind of laid back and relaxed about what they're doing. And then you start seeing how strategic they are, you know, in terms of data collection and thinking of who to connect to. And yeah, they look like sleepers, and then they do this amazing stuff. There's a lot to learn. There's so much to learn from one another. So I love having these conversations too. Okay,
Susan?
so we have, yeah.
This is Sharon Grow from Illinois.
Oh,
formerly
Sharon, that's who's on
Nebraska.
the phone. Oh, so glad you're here.
I just finished up with one of my ladies that I care for, so I jumped on by phone. But I simply wanted to, by form of testimony, saying that now that I'm no longer a state policymaker and in a whole different arena, I have, I'm waiting from our Secretary of State, but with the nonprofit to be able to provide caregiving support to a full range of backgrounds of caregivers and engaging dads to be involved with families and things like this. But a key component that I incorporated was evaluation and data collection and connecting with the existing systems in the south central part of the state of Illinois. But I just wanted to share a couple of comments to others that might be less seasoned with all the tools and everything, because as I have spent this last year just sort of in it's been quite a transition period for a number of reasons, but I have used so many of the tools that Arch has provided historically and continues to develop, and the materials that I had found useful, and constantly going to existing state programs in order, as a private nonprofit, in starting a very focused area of services for caregivers, what is the most helpful that could be available. So I just wanted everyone on the call to know, regardless of the perspective that we're coming from, these conversations and practicing the use of the tools is helpful. And there's several comments that I had wanted to just very briefly mention. If Massachusetts has not been in contact with our colleagues in Nebraska regarding the college age training and the partnering with the universities and community colleges for respite specific provider training and experience, please do so, because we had, and it continues, have done extreme amounts of work to build that system. So there were several comments that I heard that may be of help, and certainly if you've not already reached out, I know we've done any number of presentations, but it continues to be a learning process. But again, the evidence-informed work, as I'm starting from scratch on building a system, it's all about where's the evidence to show that something's working and families are using it. Because as I'm in families' homes, so incredibly overwhelmed, and with all the technology now that we're forced to use, families, they just don't have the time nor the energy to do one more thing online. So as New York is hand-holding, I think that is a key frame to keep in mind. Hand-holding is necessary. It's not necessarily babysitting, but certainly it's doing as much with the family to fill in all these fantastic resources. But they certainly want to do these things. It's a lack of energy to be able to make that happen. So thank you for allowing me to continue popping in when I can.
Oh, we love to have you pop in. And I'm glad you brought up the data collection that Nebraska has done. It's just, really set a high standard. And if you go to the Arch website and look at the research summit, some of you have attended it, but you can tap into the presentations by Dr. Caprio for the New York planning and data collection. And there is Sarah Swanson, Sharon, is do I have the name right? That gave a presentation about the Nebraska evaluation. So before you talk to, Leanne, if you decide to reach out to Sarah, you might want to listen to her presentation, and maybe you already heard it at the summit, but they're really good to listen to again, I have to say. So I just would second what Sharon's saying too about the resources at Arch, and they're a reflection of all your work. I mean, we post them up there, but it's like you're not only strengthening your own state, there's just this peer-to-peer cross-fertilization that I see going on. That's fantastic. So yeah, Thank you. Thank you, everyone.
Thank you.
And we're 2 minutes over, so I'll say goodbye. Look forward to talking to everyone next month. Reach out if you need anything from us in the meantime or from one another.
Great.
And we'll talk in March.
Great. Thank you
Sounds
so much.
good. Thank
Have a nice
you.
weekend.
Thanks, everyone.
Thank you.
Bye-bye.